So in this week's episode of Health-360, we decided to collaborate with India Today magazine to bring this special episode on Covid-19 almost 3 years on. We're calling it the Taming of Covid-19. I'm Sneha Moldani. The masks are off, the protocols are all forgotten. No one is really worried about Covid-19 anymore. Social distancing is out of the window. Everyone is going to crowded places. Nobody is really worried about social distancing and not going to crowded places, at least in India. That's what we see all around. This in spite of new subvariants being found in some states in the country. When it comes to hospitals, the hospitalizations are at an all-time low. The Covid-19 wards have been done away with or have been discarded. In fact, the symptoms are not more than sore throat. So what really is going on? Why is the World Health Organization not saying that the pandemic is over? Why does it continue to say that this still is a public health emergency of international concern? Looking at the manner in which the subvariants are spreading and infecting so many people, why is India not really worried about this infection? Are we lowering our guard? Are we doing this at our own peril? A curious dystopia has descended on the world. India is caught in it too. Its streets deserted, the people locked in their homes, wary of fellow humans' breath, food, clothes, even the surfaces they may have touched. They're washing their hands furiously, disinfecting everything in sight, part of a massive masquerade of N95s and sometimes a PPE kit. The world is in the middle of a pandemic. The novel coronavirus has tightened its grip. 2.5 years after a furious second wave, owing to the deadly Delta variant, the virus seems to have loosened its grip on us now. The masks are off. The crowds are back, as is the festive spirit. India has shown the world how to vaccinate 1 billion plus people with 2 doses. The COVID wards are being dismantled, the demand for oxygen waning, and the vaccine vials are going up begging. COVID is around, but no one is afraid of it anymore. Take a look at the number of cases reported in India in the last 1 month or so. It's been on a decline or almost static.
The spread of COVID in a country as large as India is stochastic, which basically means it is different in different areas. Depending on the geographic location, the amount of immunity prevailing in the region after a last round of infection, travel between regions that have newer sublineages, weather conditions, and the presence of large gatherings, for example, after festivals. So there are several factors that affect the spread of COVID in a particular region. India being a very large area, there will be regional variation. The pandemic is not over. Right now, several nations are facing a new surge in COVID-19, and this is likely going to be the pattern for a long time to come.
COVID-19 in the last 2.5 years has had the last laugh every time one has ventured to ask if the pandemic is over. US President Joe Biden said so only a month ago, only to have the US to extend its status as a public health emergency by another 90 days. Europe too has reintroduced the mask mandate just when it seemed it was resigned to living with COVID. The virus is still very much around, lurking in the guise of BF.7 and XBB, mutations of the last variant that was assigned a Greek letter, Omicron. However, the nature of the disease that the virus causes has undergone a sea change.
COVID patients now, it's not that they are not coming, they are coming, but most of the time symptoms are very mild. The numbers have suddenly gone down, and that is because thanks to the number of vaccinations we have achieved in India. My feeling is most of the time these are the vaccines which have really been instrumental in reducing the number of the new cases as well as the severity of the disease.
This is a far cry from March 2020, when doctors encountered their first patients of COVID-19.
कोरोना से तभी बचा जा सकता है जब घर की लक्ष्मण रेखा न लांघी जाए। हमें इस महामारी के वायरस का संक्रमण रोकना है, इसके फैलने की चेन को तोड़ना है।
Several other doctors have noticed a change in the pandemic's trajectory. Many say they don't get more than a handful of patients every month, and they haven't really seen a serious case in many months.
With the current scenario, we can say that there are a number of cases which have been increasing in lieu of the mild severity. But when we look at the broader outset, that the number of cases who have, the number of patients who get severe disease and getting admitted are very, very less. And the number of hospitalizations have come down, the number of patients requiring ventilators are almost negligible. So it's more of incidental findings nowadays when we diagnose patients with, flu-like syndrome.
Yet, while the threat has receded, it isn't entirely gone. Over 70% of the world is now vaccinated, forcing Omicron, the dominant variant of concern, to mutate in order to survive the threat of growing immunity. Omicron has now reincarnated in subvariants christened BF.7 and XBB. Countries like the US and Germany have seen an increase in cases. The UK too has witnessed a 14% increase in cases, France 33%. India's neighbour Singapore is also seeing a surge in cases with the surge of the XBB wave. Any variant that mutates so much is undoubtedly a stronger, healthier strain. Currently, more than 300 substrains of the dominant variant of concern, Omicron, are jockeying with each other for the fittest, most infectious spot.
At the present time, there are more than 300 sublineages of Omicron that WHO and partners are tracking worldwide. Not one of these subvariants is dominant. I can say that most of the sequences that are available and that are shared with platforms like GISAID are the BA.5 subvariant and its sublineages. Now we have approximately 827 sequences available to assess from 26 countries as of a couple of days ago. And we do know that this recombinant has a significant growth advantage. All of the subvariants of Omicron are showing increased transmissibility and properties of immune escape.
The WHO continues to keep the status of the COVID-19 disease unchanged.
The Emergency Committee on COVID-19 met to discuss the global situation and the way forward. The committee's view is that COVID-19 remains a public health emergency of international concern, and I agree. The committee emphasized the need to strengthen surveillance and expand access to tests, treatments, and vaccines for those most at risk and for all countries to update their national preparedness and response plans.
The manner in which Indians respond to COVID-19 is very different from the manner in which people in different countries respond. For example, in India, more than 10% of the population, just about 10%, is above the age of 60, unlike many Western countries where there are many more senior citizens, unlike India. Also, there is acquired immunity in India because of the mass exposure that we've had. In India, over 90% of the people have received both doses of the vaccine, which means that they're completely vaccinated. This is not the case in many other countries of the world. Even globally, the virus is spreading faster in some populations. Deaths due to COVID have remained below 20,000 since mid-April. The WHO says the world has never really been in a better position to end the COVID-19 pandemic and urged nations to keep up their efforts against the virus.
Where do we stand? Is the pandemic over? At our media briefings over the past 2 weeks, I have said that pandemic is not over, but the end is in sight. Both are true. Being able to see the end does not mean we're at the end. Yes, we're in a better position, significantly better position than we have ever been.
From a technical view, the pandemic is on, as there is disease in multiple nations and the WHO has not declared it to be over. But from a social view, nobody is really worrying about it because the impact on health is minimal. Exactly like human beings, even viruses want to survive, and the only way of doing it is to infect the host and to replicate, and then to move on to another host and continue with the process of replication. In the case of COVID-19, many people all over the world have gained some form of immunity or another. Well, the fact is that the virus can only survive by mutating in this case, and this exactly is what the virus is doing. It is mutating.
Omicron and its latest sublineages have proved that theory to be wrong, because right now what we are seeing around the world are multiple sons and grandsons, or what we call sublineages of Omicron, each of which has acquired what is called immune escape capability. And what is more interesting is that none of them have lost the ability to attach to the human cell or to the ACE2 receptor. This means that this virus has discovered ways of evading the human immune response while at the same time maintaining its fitness or ability to infect people.
Experts believe, and many of them hope, that COVID-19 perhaps is on its way to become like seasonal influenza, which actually started as a pandemic. It infected many people, also took many lives. Then it ran out of steam because people acquired immunity against seasonal influenza. Experts hope the same thing is going to happen with COVID-19 if it hasn't already. There is no guarantee how and when COVID might mutate into a new variant of concern. Genetic analysis says the probability is much lower today than it has been before, and that the virus is becoming more infectious, not more severe. Till then, the government can't afford to take its eyes off the ball. Booster dose administration remains an unfinished project. Another area of concern is to look at vulnerable groups such as the elderly and those with comorbid conditions. They continue to remain at the risk of severe disease. Also is the emerging challenge of long COVID. The COVID-19 pandemic is a reminder as to how a tiny virus can bring the entire world to a standstill. Indications are that humanity has now tamed the virus. But nobody really is willing to bet on this. Experts say that it would be foolish to let your guard down at this point in time. Let's now get you the statistics to give you an accurate picture of the COVID-19 situation in India, just to put this into perspective. Let's first talk about Kerala, where 90% of beds demarcated for COVID-19 are actually vacant. Also, if you talk about daily deaths, not more than 50 daily deaths are being recorded for the last 6 months or so in the country. 1% of patients in Kerala, for example, have severe COVID-19, not more than 1% of the total cases that are being reported. Over 2,600 new cases as compared to over 4 lakh cases that we had seen even in the beginning of this year when the Omicron wave or the third wave really struck us. 8 deaths are being recorded on a daily basis. 8 to 15. This is an average, as opposed to over 4,000 deaths that was recorded in the deadly second wave of the pandemic. Lastly, let's talk about hybrid immunity, natural immunity and immunity from the vaccines. Over 90% of Indians have hybrid immunity right now. Well, Omicron is believed to be the most healthy variant of all the variants of concern, and the reason is because it continues to thrive. Now, when it comes to the mutations, the World Health Organization says that over 300 subvariants of Omicron are actually mutating, which means that all of these mutations are actually trying to jockey with each other to occupy that one spot, that coveted spot of the most infectious one. And that's the reason why the Omicron and its subvariants are so infectious, so much more infectious than the other variants of concern. Let's do a comparison. First, let's talk about the Alpha variant. Infectivity, 30 to 50% more infectious than the original Wuhan strain. Severity in India, a daily death toll of over 1,000 at its peak. Common symptoms are fever, cough, body ache, and also the other symptoms of breathing difficulty when it comes to the Alpha variant. Let's now talk about the Delta variant, which wreaked havoc in India when it came to the second wave of COVID-19 pandemic. This infection in India, when it killed millions of people. When it comes to this infection's infectivity, 80 to 90% more infectious than the Alpha variant. Severity in India, where the brutal average of over 4 lakh deaths were reported in India, pretty much when the wave was at its peak, when the wave was at its worst. Now, the Omicron variant, which actually led to a huge spike in cases in the beginning of this year and led to the third wave of the pandemic in India. Infectivity, twice as more infectious than the Delta variant essentially. Severity in India, when it comes to how ill it was making people, an average of 1,000 deaths a day that was being reported, courtesy the Omicron variant, when this was at its peak, which is towards the beginning of this year also. Common symptoms, sore throat, fever, body ache and fatigue. But the most common of all symptoms is actually sore throat. That brings us to the end of this edition of Health-360. We believe that the pandemic clearly is not over. Even if we've let our guard down, that should not be the case. We should not be getting complacent. That is going to be at our own peril. Unless the World Health Organization gives a sense of direction about where this pandemic is headed, we should continue to maintain that it might just surprise us and in not many pleasant ways. You can read the entire report as well on our magazine, which is our India Today magazine special. That's a cover story. We're talking about how humanity, perhaps ostensibly, has managed to tame the COVID-19 infection. Thank you so much for tuning in.